Hello, everybody. This is Terry with Easy Healthcare Corporation, Easy at Home and Premom, with special guest, our virtual consultant spotlight, Monica Rincon. I should have checked your name. Is that right?
Yes.
All right. And I'm really excited about this first spotlight because we've been working with Monica for many months now. She's been a big part of Premom and the pregnancy guarantee. And she's one of the consultants you can work with as part of the pregnancy guarantee, or if you just want a consultant at any time during your fertility journey, she's available. So we want to learn a little bit more about you so that our users know who you are and what you're doing with us. So can you tell us a little bit about yourself and your educational background, your experience?
Okay. Thank you so much for inviting me today. And again, my name is Monica Rincon, and I've been in the field of natural family planning, helping couples to achieve and postpone pregnancy naturally, just following biomarkers. So LH is a type of biomarkers that can help women to determine when is their fertile days. And I've been, as I say, 20 years in this journey, helping couples, women to that they are not married, but they wanted to understand how is the fertility works, and actually they want to be advocate of their own health, to tell that when they ovulate is a sign of health, not only because you're postponing or you're achieving pregnancy. So I received my first, my bachelor is in science with a major in laboratory techniques. And after that, I did a master in macrobiology. My bachelor and my master is from Colombia. Later, I traveled to the United States and worked with the public health department laboratory in San Diego for 6 years, and moved to Canada and continue working always in natural family planning. And I just finished a master at the University of Calgary to update all my credentials. As well, I'm a certified ovulation method teacher, market in FEM, finishing the accreditation with FEM. So I don't know how many couples I have been taught through all these years, but for me, it's a very rewarding experience to empower couples and women.
All right, thank you. I learned quite a bit about you myself right there. You had quite a background. And I know we did a little bit of talk about FEM with Premom, and we're really excited that you added that training. And also, I also just wanted to mention that you speak Spanish, and hopefully we can take more advantage of that. I know we do have a Spanish TTC group, so hopefully going forward we can use you
Looking
more for
forward,
that.
really, really. Yes.
Yeah.
Yes.
And I love that you are continuing to learn. You've written a lot of blogs for us, and you've done medical reviews of the blogs that we've written. So those of you out there watching this, be sure to check out Monica's blogs on premom.com. There's a lot of great information in there. Why did you choose to work with Premom?
Well, when I was finishing the market method training to be a teacher, and through the colleagues and nurses and Mary Schneider, who is one of the directors of the Natural Family Planning Institute of Natural Family Planning College of Nursing of the Marquette University, she sent through all of us this great opportunity. And she said, you already have certified, you have your hours of teaching, why don't you apply it if you want? So I did it. And sure enough, so I'm here since, I think probably since October or November last year. So it's going to be almost 1 year with you guys. And thank you so much for this opportunity.
Wow, already. Yeah, and you're teaching so much. You teach through your consultations, you teach outside of the
Yes,
consultations.
yes, my
That's
private,
wonderful.
yeah, my private practice as well. Um, yeah, and then I want to send even to teenagers to teach them fertility awareness. That is very important because for the medicine background that I have, we have seen that when a woman can identify when they ovulate is a sign of health, because it means that the metabolic, endocrine, and reproductive hormones are working optimal, and that's what we need. And we need to see fertility as a gift, not as something that we need to be, not to be aware of that. It is part of being a woman. And it's easy for women to determine their fertility because we cycle with our menstrual cycle, similar to the moon changes. It's a, something natural in the environment. So men are always fertile, but women have different steps in every menstrual cycle. So it is important to empower women when these signs are healthy and where are not, and where they can find answers of what they are feeling, seeing, and they know in the tip of their heart that something is not right, that is not optimal. And
Right.
that's what I like to do.
I love that. And so just that one answer you gave there was so compact. I love that you talk about educating teenagers because I don't know if it's different now, but back when I was in school, I didn't learn any of this stuff. I learned it all through this job. It's really sad. Like I should have known this stuff, but I learned it because I worked this.
Yes.
So there's that piece. And then I love that you talk about I think that, like you said, with FEM, they're all about learning about your health no matter what you're deciding to do with your fertility and how useful your fertility cycle is to your health. And I know I talked with you once about how I had just published one of your blogs, so I was
Mhm.
very, I had been in the content a lot. And I was looking at my own fertility was happening. I'm like, well, yeah, I'm definitely stressed. so so helpful to know like what's going on with your body and what's normal and what that's telling you about what's going on in your life and giving you those warnings. Your body's telling you what you need to be doing. It's just
Yes.
another way. It's really awesome.
Yeah, we are our bodies, and we need to learn to understand how they work and to receive the fertility as a gift,
Mm.
not something that we need to be shame or something like that, or just use it because I want to get pregnant. No, it's part of us, and that's what I like to do. I don't treat, I don't do diagnosis, but I teach,
Mm.
and that's what is the most important for me is to tell women that this is what is happening, this is how you learned. And when you incorporate fertility as a part of your day, it is like brushing your teeth. You really know, oh, this is day down, I'm going to take my LH, or how I feel. Do I feel humid? Or maybe yes, and maybe I'm fertile, or I feel dry. I'm having premenstrual syndrome. I can talk to my doctor. So they advocate themselves in
Mm.
order that they make of their lives easy and more enjoyable and more healthy in terms of endocrine and reproductive and metabolic choices that they need to have.
Yeah, it's very empowering, which I know is very important to us at Premom, is putting the tools in the hands of our users so that they can have their best experience and take control of their fertility. We talk about that a lot, taking control of your own fertility. So that's
Yes,
really awesome.
yes.
So can you tell us a little bit more about what you specialize in or who you enjoy working with in particular?
I enjoy working. Most of the patients that I work are couples of clients, and most of them they are postponing pregnancy naturally, so they need to learn when they are the most fertile, and they can make a decision if they want to postpone or achieve pregnancy. But they don't use any other means to destroy the totally gift and unity that they are as husband and wife. So that's what I mainly do. But in the run, in my private practice, I have as well couples that they want to conceive and they having a struggle. So I teach them what is the best time, because even if you have sexual contact or sexual intercourse during the times that you're not fertile, it's very hard to get pregnant. So first, I teach them that when is the most fertile time, and after that, if it's not happening after 3 6 months, knowing exactly using the days that are correct, I definitely, if I see something in the charts, in the way that the curves are showing, temperature, mucus, all these kind of biomarkers that tell us if our fertility is optimal, I definitely advocate them with their family doctors. to have tests, to have more kind of research or trying to see what is going on exactly. It could be metabolic, it could be sugar, it could be insulin, it could be testosterone, it could be anything, even thyroid. So what we want to do is that to correct the baseline problem, not only to treat the symptom like acne or premenstrual syndrome, just to correct what is the baseline, and later, so they, once their fertility is again optimal, they can achieve pregnancy. So when they need to go to an OBGYN, what are the type of tests that we like that they will have? So that's what I, as always try to do with my couples that are trying to achieve pregnancy.
Wonderful. And I love how you touched on both there, because I know at Premom we focus mainly right now on trying to conceive, but we are looking to have a trying to avoid mode as well. And couples are going to experience both of those likely in their lifetime, even between babies. So that's great that you have that background. Can you tell us just a little bit about NFP a little more? I know we're going to have you on again and probably do a Q&A in one of our future lives, but could you just tell us a brief history of NFP and how ovulation testing fits into that?
Yes. So natural family planning started what we call the rhythm method, but we know that it only works for women that have regular cycle. So in 1956, two doctors, Dr. Evelyn and Maria Billings, they start looking at how the menstrual cycle occurs. And they found that exactly women are cycling. So they have a mucus that is produced because of the effect of estrogen. And after estrogen has rising up and create a raw egg white type mucus, they noticed that ovulation were going to be occurring in the next 3 days. So based on that, they developed this method to postpone pregnancy mainly. So it was launched in Lancet, a very important journal, in 1963. And after that, there have been other studies based on this method that is called the cervical mucus or the Billings ovulation method. And we now, since the 1980s, we have all these technology like monitors, like Clear Blue monitor that allow you to test estrogen and LH. And now you have LH strip, like the ones for Premom or Easy at Home, that are very accurate to tell you when the LH, which is the hormone that predicts ovulation. So it is telling you that you're soon going to release the egg. So women, most of the time, 99.9%, will release one egg every cycle. And so this hormone LH is going to allow you to pinpoint when in the next 24, 36, 48 hours, your ovulation is going to occur. And that's the good thing about having now tests at home, like Premom or Easy at Home, to advocate yourself and say, okay, this is working with the temperature. And so we teach women to empower themselves, knowing their fertility. So
Thank you.
natural family planning is methods to postpone or achieve pregnancy naturally based on biomarkers. Um, and we don't use any other kind of contraception to postpone pregnancy. Just only determine when is your fertile window. So if you're postponing, you don't have your abstinence those days. And if you're achieving, you use those days. And in the fertile phases of the cycle, that is out of the LH and all this that is positive, the mucus, they have intercourse during those days. That is what is natural family planning.
Wonderful. I know we're really excited to work with you and other NFP professionals because you do work so much with those biomarkers and you have that chart experience. So you're just a natural fit with Premom that focuses on the ovulation test, on the charting, on looking at the ovulation test, the BBT, the cervical mucus, all in one place. So that's wonderful. Can you tell us, to close up here, a little bit about what someone who has a consultation with you can expect from a consultation and maybe some testimonials of what people have shared with their experiences with you?
Well, first, with the consultation, I always, even I have access to see their charts, and Premom has already like an algorithm. So something that already tells me, this is the cycle, this is the length of after ovulation. So already when I receive the consultation, I have already a lot of information about their cycles, and I can look at the LH, the BBT, the cervical mucus, when they have, if they have focused intercourse in the fertile window. After that, I always ask them how I can serve them better. So what are their concerns? What they exactly they need? It is nice if when they book an appointment, they can send us a message saying, this is all my concern. This is all my history. This is so we can use these 30 minutes of consultation the best we can. After that, if they have been trying for a couple more than in the guarantee program, that is more than 6, 7 cycles, and they already have some kind of concern or frustration, what is going to happen, I like to ask a lot of questions about what could be. And depending on what they exactly need, some of them need like something that it will create a better egg. Or so we have Dr. Phoebe that she's really good at supplements. She's a naturopath doctor that she really knows how to do supplements. I really recommend don't take any kind of supplements. Even you can have it until a doctor or a naturopath is really telling you that you need it based on labs. We like that they share the labs as well. Anything that they have been done. Some of these consultants already, they have other fertility treatment, but since COVID-19, they cannot come back. So we try to help them as well. We have Dr. Owen, that is a femme doctor, and he's a restorative reproductive doctor. So he wants to restore your reproductive health and understand why you're not conceiving. So I try to answer the questions that they have. I given in the message kind of a plan. This is going to be the plan. So for example, if they know exactly when are the most fertile day, I say, okay, you're going to try with this, what I'm telling you, for 3 to 6 months. But if it doesn't happen, you have to go back, because we want to follow up these consultations. It's not just a consultation. We really want that these women, if they have any problem with the reproductive, they have their optimal health return and they can achieve. Or they look with their family doctors, they can advocate themselves and say, I'm doing this. You can see through this app that I'm doing the LH, I'm doing the temperature, I'm doing the mucus. I want that you send me a panel because I already have been trying for 6 months or 1 year, which is the minimal time that a couple has to be trying to conceive and is not achieving pregnancy. Family doctors will investigate what is the problem or send into a fertility clinic.
That's so wonderful that you help them through that process so that they're completely informed and have the information if they need to go to a specialist or go that one step further. What is some feedback that you've gotten from the consultations you've had so far? Have they talked about any changes or information they've learned?
They are very grateful. Some of them just need someone to listen them because they are struggling. Women feel very frustrated. They feel shame that they are not conceiving. They don't know what is wrong with them. And women suffer from emotional and distress because they are not conceiving. So sometimes I know that I just need to listen them and telling me what exactly they're having going through. And so it's good to have, because we're women, we're social, we need each other. And so sometimes just listen to them and later talking with what they can do and empower that they are doing the correct thing is just enough for them at this point. Some of them really know everything, but they just need someone to listen. As well, if I see that stress could be a cause, we try to use what Premom has a partner with organic conceptions. And I have some of them that have been going through that and they are very happy. And I
That's so
like to share that Mark, he has really good YouTube videos that sharing experience, personal experience, and with other clients in organic conception that is good for them. When I see really that there's a really problem, more than 1 year and a half trying, and they are not getting pregnant, immediately I'd advocate to their family doctors and send letter telling the family doctor exactly what she's doing. She's using this. I put the links of Premom that this is what they're doing and that they can do the LH. And I asked them, please, to have this hormonal panel. So we have been cases that already are going through under treatment. Hopefully in 3 or 6 months, they can get pregnant. So I
Wonderful.
think Premom is doing a really good job in helping and empowering women, not only being able to see if the LH is positive, but looking beyond that test, looking that beyond that test, there's a human being. There's a couple that is struggling. There's a woman that wants to know their fertility. And since technology now such available, we can get united with these Facebook groups, with Premom's apps, with doctors' consultations, and even emotional treatment like organic conception. So I think we have to create kind of a web in order to work together for the good of the people and couples, marriage that they want to have a baby. So
Oh, that's so beautiful. Thank you. You just did such a great wrap up for me. 'Cause we actually are going to talk about organic conceptions a little bit next week. So, those of you who are watching, watch for that. You'll get a little bit about what that is. And we will have Mark on again as the class gets closer. We're going to have a special Premom class connect with organic conceptions. And we do hope to have Monica on again soon to talk more about a topic, probably about natural family planning, possibly in a live video. And thank you so much for joining us today, Monica. If you would like to work with Monica, you can find her right in the Premom app. If you look under consultations, you can either consult with her as part of the 9-cycle pregnancy guarantee program as one of the free consultations if you are up to 6 cycles trying and still haven't conceived, or you can have a consultation sooner if you want to check on things sooner and you can't get in with your doctor. There are lots of options through the app, and we're so excited to share Monica with you as our first spotlight. So, thank you again, Monica,
thank you.
and thank
Thank you
you for all
for
of
the
you for
opportunity.
watching.
Yes, thank you. Okay, have a good afternoon. Bye bye.